Good. All right. Well, welcome everybody to the University of Montana School of Public and Community Health Sciences weekly public health seminar. We are super excited this week to have Julia Goar here with us. She is the Public Health Emergency Preparedness Coordinator at Missoula Public Health, and I believe may even wear another hat or two, but she can talk about that. But she is here to talk to us today about, basically what does public health emergency preparedness look like? And it's a really important topic. I think it was sort of put in the forefront of the world's mind during COVID, but the fact of the matter is that public health emergencies are not limited to global pandemics. And so super excited to have this presentation today. And with that, I will pass it over to Julia.
Perfect. Thank you so much for that wonderful introduction. So yeah, I'm Julia, and just a little bit about myself. And this is my kitty cat. Her name is Bat, and she's on the screen there as well. Always have to introduce her because she won't be happy unless she introduces herself or interrupts my presentation. So I'm originally from Kitsap County, Washington, but I've lived in Missoula for about 13 years now. And outside of work, I love the three T's: trail running, travel, and tattoos. Those are kind of my hobbies. But within kind of my professional resume, I do have 2 degrees from the University of Montana. I got my bachelor's degree in health and human performance with a concentration in community health, and then got my master's degree in public health as well. I'm also a certified health education specialist and an EMT. I've kind of worked all over the place within public health. I've done health education, health research, patient care, kind of bouncing around healthcare quite a bit. And I have quite a bit of volunteer experience as well, both here in Missoula and internationally, both in India and Indonesia. So if you've seen my name before, it might have been because of my master's research in Indonesia. And like Damien was saying, I am currently the emergency preparedness coordinator, and I also volunteer with the All Hazards Incident Management team, which I will talk about a little bit later. So I just give that introduction to emphasize that I've been around the block with public health over the last 10 years, and I did not hear about emergency preparedness, public health emergency preparedness, or FEP as a discipline until COVID. And I'm glad that Damien mentioned that in my introduction, because that is how a lot of people know about public health's role in emergency response, but it does go beyond that. So going into COVID, straight out of my master's degree, I was like, how have I not learned about this? How do I not know what this is? So we're going to spend this presentation doing a brief definition and history, so we kind of know where all of this came from, and then what this looks like within our local health department at Missoula Public Health. I'm going to talk about partnerships and current projects I'm working on, and then just things for all of us to consider, either as practitioners or students or wherever we find ourselves in this community, what FEP might mean to us. I also like to mention to please take care of yourself during this presentation. I joke that it's my job to sit around and think about horrible things, but I realize that that's not everybody's job. So if this gets a little heavy or you need to take a break, just please feel free to do that. I need to move this little chat box out of the way so I can see what I'm doing. There we go. So what is public health emergency preparedness? FEP utilizes phases of emergency management, which is preparing for, responding to, and recovering from public health emergencies. And you can kind of see that wheel off to the left. FEP helps health departments build and strengthen their abilities to respond to all sorts of disasters or emergencies or incidents, whatever language you prefer, but emphasizing on the public health effects of those emergencies. At the state level, our Department of Public Health and Human Services They oversee all of the emergency preparedness programs across the state, and they help each of our jurisdictions and counties through leadership and collaborative partnerships to, again, respond to these events. There we go. So just as a history, so public health and emergencies and emergency management and disasters have been going on for forever. Before we even had any kind of organized way to respond to them, especially shout out to our frontline health workers and nurses. They've been responding to things like yellow fever, smallpox, HIV/AIDS for a very long time. And then also our other first responders that respond to things like hurricanes, floods, industrial chemical releases, all sorts of those things. But the relationship between public health and emergency management kind of came together after September 11th, 2001 with the terror attacks in New York City. Out of that event, we as a nation decided to prioritize homeland security as an apparatus of the government. That branch of the government didn't exist before that time. And we also adopted the National Incident Management System, basically because all these folks came crashing into New York City because they wanted to help in the aftermath of this attack. And it went well, but it could have gone a lot better. For example, rural fire and city fire don't use the same like numbers and codes when they talk over the radio. And so there was a lot of confusion, same with different police departments or EMS providers. So as a nation in the aftermath of this, we're like, whoa, 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 we need to organize this a little bit better. And then a little bit down the line, just that last bullet point, Congress decided to start funding public health emergency preparedness programs all across the country through the CDC. Again, before this time, we did not have that. So just a little refresher, or maybe this is the first time you're seeing something like this. I started to talk about the incident command structure, or ICS, and this is what it kind of looks like. So again, if we think about something as big as 9/11 or something as small as a wedding, we could use this organizational structure to help us organize that incident. Having a commander at the top and then having folks designated to take care of specific parts of the incident. So we have a public information officer, so we get information out to the public, a safety officer to make sure everybody's staying safe, especially responders. A liaison officer, their job is to, if there's multiple jurisdictions or many stakeholders that are affected by the emergency, they help coordinate all of that. So you could have police, fire, fish, wildlife, and parks, city streets. I'm thinking of the windstorm we just had in Missoula. All sorts of people responded to that. So the liaison officer helps liaise through all that coordination. Then we have operations, which does the thing, whether that's cleanup or search and rescue or fighting a fire or giving out vaccines or doing COVID testing. That's operations. They do the thing. Logistics, kind of skipping over, they get the things so operations can do their thing. So we can't do COVID testing without gowns and masks and face shields. We need somebody to get those things for us. That's logistics. Finance pays for all of those things. I think their biggest, most important job is working with FEMA, or the Federal Emergency Management Agency, to get reimbursement or all of those different things. And then booping back over to plans, they keep everybody organized. So making sure that our schedule is on track, that we know what we're doing the next day, and they also take care of all of the personnel. So what does FEP kind of look like within Montana? And I kind of already touched on some of this, but again, coming down from the federal government, we have a cooperative agreement, and we have funds that go to state, local, territorial, and tribal health departments. This has been going on since 2002 after September 11th. And again, DPHHS oversees my program here in Missoula. And we have all sorts of different hazards, health hazards, emergencies that could happen in Montana. And obviously, this is not an exhaustive list, but communicable disease, food water contamination, chemical spills, if we have a train derailment like we did over in the Yellowstone, getting fuel and other things all in the rivers, wildland fires and smoke, drought, flooding, earthquakes, tornadoes, avalanches, wind events like we saw this year. That's not on my list. And this will change from region to region. Down in the south, they're having a massive hurricane, so we don't have hurricanes up here yet. You can't say never, I suppose, but those are just some things that we need to consider. So going over the core capabilities of public health emergency preparedness, I'll go through these relatively quickly. So I definitely promote community preparedness as well as recovery. So as a public health unit, we usually don't respond directly to the emergency, depending on what it is. Again, that's more of fire and EMS and police, but that's definitely something we could be involved in, like a chemical spill. We might need environmental health specialists to be on scene, or in a pandemic, we may need nurses and other folks to be directly on scene. So kind of wavers back and forth there. Emergency operations coordination, public information and warning. So definitely working with our local resources to make sure people are well informed about what they need to consider during an emergency. Goodness forbid, fatality management. So if we had a mass casualty event, we need to think about how we are dealing with the decedents of that event. Information sharing, mass care, medical countermeasure dispensing and administration. So this kind of gets into maybe some COVID examples. If there was like a medicine that could have helped people during COVID and we were going to dispense that, that's something that we could have done. I think a vaccine could definitely be an example of that. Medical material management and distribution, things like masks, medical surge. So working with our hospitals if they have a huge influx into their ER or other wings of their hospital. Non-pharmaceutical interventions, again, that could be masks or other like gloves, things that folks might need. Or another example could be like water treatment or air treatment if we have really bad smoke. Public health laboratory testing, so helping coordinate if we are doing testing of water or people or whatever we may be testing, making sure we have the systems in place to get those samples off to the lab. Surveillance and epidemiology, of course, responder safety and health, of course, and then volunteer management. Like I had used the example earlier of 9/11, people want to help each other, which is really awesome, but sometimes that can be a little overwhelming if you get a big crash of people in your community after something bad happens. So this is that's a lot, right? This is kind of how my brain breaks it down. So here are some events that could happen in Missoula that I try to think about. Some things that I added in that we haven't talked about yet is overdoses from opioids or mass casualty. What is the effect of that? So I'm kind of worried about what would happen to our infrastructure if our bridges went out, if we don't have clean running water, if we don't have power like we did during the windstorm. Some people were out of power for over a week. If we don't have climate control, people could get too hot, too cold, and become sick because of that. Loss of homes. What if we got to get people the heck out of here? Where are they going to go? How are we going to transport them? If we have something spilling in our river, is that going to poison people? I put gender-based violence on here because when things go badly and we have to shelter in place, sometimes our shelter might not be the most safe place for us to be, unfortunately. We did see spikes during COVID and that lockdown with gender-based violence. Thinking about opioids, we could have addiction, we could have morbidity and mortality. And then from a public health lens, I try to think about who is the most at risk. we are all at risk from emergency, but we all have specific needs, or if we're already disenfranchised in some way, then it's going to be harder for us to be resilient during those times. So I try to prioritize reaching out or making our plans revolve around our most at risk. Who else responds? I obviously don't do this by myself, which we will be talking about partners a little bit later. And then what goes into recovery and resiliency? This is something that I take very seriously because of COVID. I think a lot of us, especially if we worked in COVID in medicine or public health or however, we're still some of us in our hearts are still in recovery, right? We got so burned out, we got so much thrown at us. Recovery is a big deal. And then how do we build resilience out of that space and make sure that we're ready for the next one, whatever that might look like. So this is kind of an outline of what I do at our health department. Some of it isn't very exciting, but it's necessary. So I maintain our public health directory. So if something goes wrong, there is a public health directory online that people can access, and I make sure that's up to date. So when you pick up the phone to talk to our health officer, you're not calling Damien because he's not our health officer anymore. You're going to be talking to Gina. So making sure her name and contact info is up to date on there. I track immunization clinics and report that to the state. I also help with staff trainings, making sure our internal staff are trained, including sanitarians, and everybody is up to date on incident command structure, which we had talked about earlier. We do communication tests with the state. Again, if something goes wrong, we want to make sure we're able to communicate. I do a lot of community outreach and education. I'm very passionate about PhEP, and so this is just one example of me reaching out, but I try to reach out to the wider community as well. And then I oversee our very specific kits that we would have to use if something went wrong as far as a chemical spill or if our drinking water was contaminated. We have very specific kits for that. So I make sure that those are up to date as well in partnership with our fire department. I think the most important thing that I do is I make sure that our internal emergency operation plan is written and it's up to date. So we have a basic plan that is like a wide brushstroke of what we do in an emergency. And then there's functional annexes that break down kind of more specifically what we would do with a communicable disease, if we had to do a bunch of lab transports, how are we going to communicate, emergency countermeasures, and then continuity of operations. So just because COVID's happening doesn't mean that we don't have to keep testing wells, or that animal control doesn't have to do things, or that STIs aren't still a big deal. So even if things are going very strangely, we still need to continue the normal operations of the health department and what we are responsible for. I'm also working, and I'll chat about this a little bit later, but I'm also working on adding in annexes for overdose spikes and for environmental emergencies. So outside of that, these are some other projects that I'm working on. So kind of delving a little bit more into trainings and education, focusing a little more on internal to the health department. So like I was saying earlier, there's a wide variety of different emergencies that we could respond to. So I want to make sure that our staff at the health department is well trained in emergency preparedness and response, and that all of our staff understand that if something goes strangely, we will be called upon. This is not a voluntary thing of, oh, I might like volunteer at some point to do something like COVID. Like, it's all hands on deck if we have a big spill or an infectious disease. A lot of the health department could be pulled into that. We are also currently going through reaccreditation. So I'm combing through our plans with a very fine-tooth comb to make sure it matches our reaccreditation standards. I'm working with two different sets of interns. Every semester, I have MSU nursing students that are studying here in Missoula, and they get to learn about public health emergency preparedness. They are helping me with the environmental emergency plan annex that I mentioned, because moving forward, one of our strategic plan agenda items for the health department is to look at climate change and how we are reacting to that within the health department, and maybe what our responsibilities would be to the public. And that obviously is going to have a huge effect on emergencies. We're having crazier weather, we're having hotter, drier summers, we're going to have more wildfires, we could have either colder winters, maybe warmer winters, maybe we'll have some droughts. I don't know. I'm not a climate scientist, but we need to be prepared in my shop for whatever climate change throws our way. I also oversee the Access and Functional Needs Subcommittee of our LEPC, which is our Local Emergency Preparedness Committee. And just as it sounds, access and functional needs is one of those high-risk groups. So if you have an access need, that could be, I rely on public transportation, or English is not my first language, and so communication could be hard for me. A functional need could be, I am blind, or I don't see very well, I don't hear very well, or maybe otherwise I'm perfectly healthy, but I just happen to just break my ankle and now I can't drive, so I can't evacuate myself. So all sorts of different access and functional needs throughout our community that we need to incorporate into our plans. So with that subcommittee, we are really prioritizing Smart 911, which is our two-way alert system within Missoula County. So if something is going amiss, if you sign up for Smart 911, you can get alerts directly to your phone. Also, if you opt in and you let 911 dispatch know that you have an access or functional need, if, again, things are going poorly and maybe we need to evacuate, they might send like a sheriff's officer to your home to make sure you're okay, that you're not left behind, that you get that extra help that you need. Another project I'm working on is a mobile morgue, going back to those core competencies. If we ever have a mass casualty event where we have a plethora of decedents and our morgues that we have in Missoula are not enough, then we need another option to store those decedents until the next step. This could, I'm hoping, can be, well, it's right in the name, mobile. So I'm hoping that it's something we can relatively easy pack up and move around the region. So if something happens in one of our adjacent counties or jurisdictions, that we can loan that out to them as well, since Missoula is the resource and medical hub of this region. And then I've mentioned this a couple different times, but me and Leah Fitch Brody are working on an overdose spike alert system. So as we're seeing more overdoses throughout the country from various substances, but most notably opioids, we want to make sure that we're tracking that, and that if we do have a spike, which we have decided is 3 or more in a 24-hour period, that we are able, agency to agency, to talk to one another, make sure we have all the resources we need, make sure that everybody has enough Narcan, has enough fentanyl test strips, etc., making sure that all of this information is shared within responding agencies. And then hopefully our next step is to start transmitting that information to the public. That is a little more nuanced, which is why it's taking a little more time, but we want to make sure that we're giving the community as much timely information as we can to hopefully prevent some of those overdoses from happening. So I mentioned partnerships. So emergency preparedness and response and recovery is such a team effort. And these are just some of the partners that I rely very heavily on. The Regional Healthcare Coalition meets once a quarter, and we make sure that we all have what we need and we work on projects together. The Office of Emergency Management is kind of my right-hand agency that I'm always depending on, as well as EMS, fire and law enforcement, the LEPC, which I already mentioned, and then the AFN subcommittee. Key surveillance partners. So this has more to do with infectious diseases, but hospital labs, schools, daycares, and clinics they all report to us with cases of infectious disease. And I work very closely with our infectious disease nurses at the health department, and we work as a team to make sure that that is all buttoned up. Work closely with the University of Montana through those internships, and then the Rural Institute as well. Summit Independent Living really helps me out with the Access and Functional Needs Subcommittee. I also am working on a relationship with the International Rescue Committee because that's a large section of our community that English may not be their first language. There may be some hesitation with trusting law enforcement or first responders. If we have to evacuate and there's a sheriff's deputy banging on your door, that can be really scary. So making sure that we have hopefully some understanding before that happens. And then also the Salish and Kootenai Tribal Health, they also have a FEP program, and so I work with them quite closely. So I mentioned the Office of Emergency Management, and when I describe my job, people kind of like, oh, so you work for OEM, you work for the Office of Emergency Management? I'm like, no, I'm still at the health department. And I can understand why there's that misconception. In the Venn diagram, we share so many tasks and responsibilities. The Office of Emergency Management, just as it sounds, they manage emergencies when they happen. They also house 911 and the call center. So they're more on the response end. I'm more on the preparedness end, though they also do a lot of preparedness activities. FEP, I believe, needs to stay separate, and I think it needs to stay within the health department because public health emergencies are a little different than just your standard wildfire, right? As we saw during COVID, the human element when it comes to an emergency is a big deal. And I think we need public health practitioners to be a part of this world, even though sometimes it's kind of uncomfortable to be, or maybe just out of the ordinary to be in a meeting with the sheriff or the police chief or the fire chief. At the end of the day, we will be working together during these emergencies. So I think keeping a public health lens in emergency preparedness is very important. And that kind of moves into my next section. So why does this matter? Why am I presenting about this? Emergencies affect all of us. When there's a wildfire, we all share the same air. We all enjoy the same rivers. We live in this community as a community in groups, but also as individuals. So when things go wrong, we need to make sure that we are prepared outside of our job, like in our personal lives. What are we doing to make sure our community, our families are ready for an emergency? Specifically as a public health professional, like I kind of started to talk about earlier, you could be called upon to respond. So I'm an alumni of the Master of Public Health program here at UM, and I didn't really think about an emergency ever being something I would have to do as a health department employee. I always wanted to work at the health department. I'm like, yes, my local health department, that's where I want to work. Or even as a student, if you're thinking, oh, I'd rather work for a nonprofit or I'd rather work for a hospital. When things go weird, you may get called upon. And if you work for the health department, that likelihood becomes exponentially more. If it's an environmental emergency, as a sanitarian, you could be called upon. If it's an infectious disease, as a nurse or someone who works in health services, you could be called upon. The overdose spike alert system, that's a part of health promotion at the health department, and our infectious disease nurses work within health promotion. More on the administration side, all of our communications, all of our Instagram and Facebook and finance, all of that is activated in an emergency. So and of course, COVID showed us we are not just siloed away. This affects everything. So that's something to keep in mind, either if you work as a public health professional or you're an aspiring one. And then building resiliency into our workforce is something that I'm very passionate about. Again, because of COVID, our local health department saw about a 60% turnover rate in the wake of COVID, and other smaller health departments around the state had a 100% turnover in the wake of COVID. So you have whole health departments that have completely turned over their workforce. You have none of that institutional knowledge. And I don't blame anybody for quitting their job, retiring early or on time, or just choosing a different profession. We all had to deal with COVID in our own ways, but it's really important to me that moving forward, we don't forget COVID. We don't just block it out because it's unpleasant to think about, that we continue to train and think about PhEP so that we're more resilient going into the next one. So next steps, like I've kind of already harped on, it all starts at home. Personal preparedness is really important. What are you going to do if you have to evacuate? Are your pets taken care of? Where are you going to go? Are you going to rely on a shelter? Are you going to rely on public transportation? Do you have your own transportation? Do you have enough of your prescription medication to get you through? Are you power dependent? If the power goes out, do you have a battery bank or a generator? These are all things that we need to think about as individuals. I just gave a bunch of examples, but how would an incident affect your work? Whether that's, just bad air from a wildfire smoke all the way to a train derailment, mass casualty, COVID type incident. How would that affect your work? And what are you doing now to either build resiliency or make that a part of your plan moving forward, maybe a goal or an objective within your own work? If any of this is sparking your interest, there are many trainings you can take. One example that is for free and on your own time are the FEMA ICS, or Incident Command Structure courses. I would recommend taking 100, 200, 700, and 800. Those are all kind of the foundation classes. And if you just Google search FEMA ICS, you'll see it. You'll have to sign up for a FEMA student ID, but beyond that, you can take their courses online for free, which is really great. They are a little dry, but they definitely help give you a foundation. And then semi-annually, I think the state tries to get one at least once a year. ICS 300 and 400 are in-person classes that you can take, that you kind of do tabletop exercises. You learn more about the command structure like I showed at the beginning of my presentation, and you can put on a vest and say, I'm the incident commander for this. What are we going to do? What are some things we have to consider? And it's a lot more fun. It's a lot more engaging. And then it makes it a lot more real. And whoever is teaching the courses can tailor it to your discipline. So like firefighters, of course, use ICS all the time, but we would also use it in something like COVID. So if I'm training, folks at the health department, we're going to use a public health example and tailor all the material towards public health, which I think is really great. I mentioned this at the very, very beginning. I'm also part of the Western Montana All Hazards Incident Management Team. So they are a team that responds to hazards all over Montana and all over the country. They've deployed to hurricanes down in the south. They helped Lahaina with recovery with the fire in Hawaii. They go all over the place. They do all sorts of different incidents, hence the name All Hazards. They definitely helped with COVID as well. Helped us run our vaccine clinic here in Missoula, and then also I think went to the Northern Cheyenne Reservation as well and helped with that. So they are a great team. even if you're not interested in joining the team, but you have more questions about what all of this could look like for you or your agency, they are a wealth of information. If you reach out to me, I can connect you with the incident commander of that team. And that is all I have for my presentation, but I would love to field some questions. And I'm going to leave this slide up for a while, just in case you want to jot down my email address if you want to reach out in the future.
Great, thank you so much. So for folks, if you have questions that you want to put in the chat, please feel free to put those in the chat. Otherwise, now that we're in the Q&A session, also feel free to unmute and ask Julia your question directly. There is one question in the chat, Julia. I don't know if you saw.
I see that. So it says, after Missoula's July derecho, which is the wind event, what was surprising that city county weren't prepared for and will do differently next time? That is such a great question. I was a part of that response, but I will give a little caveat that I was a couple days late. I had just deployed to a wildfire, and we returned home the evening that the storm hit. And so we were still on fire standby for a couple days, and then the team had 2 days off, and then we started the response. So from my perspective, what was surprising, or what we were not prepared for? I think Northwestern Energy and the Missoula Co-op, who buys their electricity from Northwestern, so it's all the same infrastructure. I would say they did a outstanding job getting the power back on. I know some folks were without power for like up to a week, but they worked so hard to get the power back on, and they were really amazing to work with. I think one conversation that just continued to happen was debris management. I don't think that's something we do very often in Missoula versus Louisiana, for example. They get hit by hurricanes all the time. And so debris management is like their bread and butter. They know what to do with a tree when it falls over. We don't have that very often here. And so I think that kind of took us by surprise. But thankfully, we had a like a debris specialist come in and help us with a lot of that. She was fantastic. So I think maybe having some more plans around debris management would be really helpful. And then I think, as far as like kind of thinking about the next time, I personally feel like we dodged so many bullets with the derecho. One of them was that the storm itself did not cause any casualties. And I think that was so lucky of us that a tree didn't squash someone's house while they were in it, or a car and took someone's life. That didn't happen. So that was really amazing. I think if that would have gone differently, the response would have been different. I think our hospitals would have been a little more overwhelmed. And then I also want to consider, with power outages, that can be a life and death situation for folks too. If the weather is extremely hot or extremely cold and we don't have climate control, that can be a big deal. Also, if people are power dependent, so they're on ventilators or they need to refrigerate their medications, that can take someone's life as well. And from my understanding, quite a few people just sheltered at the hospital, and the hospital was able to kind of absorb that. But again, if we had more casualties or we had, different circumstances, it could have gone very differently. So I hope that answers your question. The next question in the chat. Oh, curious to see how you and your FEP colleagues have seen AI used. or see its potential or challenges to help with FEP deliverables, policies, etc. This is something I keep hearing in smaller county conversations. No, I did not talk about AI at all, Lisa, so I'm really glad you brought this up. So I went to a preparedness conference at the national level this last spring, and there was a lot of sections on AI, but I was very disappointed that it was mostly people just trying to sell AI software and not really talk about what you're asking about, which is what are the ramifications of that. I have heard many colleagues, both in the health department, across the state, across the country, say, yeah, I just plug into AI. I need a liaison meeting agenda for these agencies. Make me an agenda, and it pops it out. And it's really great. I definitely think that it has its place. It obviously needs to be spell checked, like you need to fact check it and make sure it's all good to go. I think what's tempting about it specifically within emergency preparedness and response is our timelines are so compressed during an incident. Like we have to work fast and we have to work right and we have to be very efficient and effective. And so using tools like AI to speed it up, I think could be helpful, and it's at least very tempting. I think one big downside would be security. So if I use AI to write our emergency plan, but then someone who wants to do us ill gets a hold of that, and then they know exactly what our weaknesses are, and then they know exactly how to target us if it's a man-made, a person-caused emergency, that can be a really big deal, which is something we talked about at that national conference. And something I haven't talked about in this presentation at all is that emergency preparedness and national security go together, whether we like it or not. They're people who want to do other people harm, and so they can definitely use different strategies to cause emergencies. So I think Missoula County and the health department are both working on AI policies. So I don't think we have anything right now, but it's in the works. And Kimber, I see your hand up. How are you? It's good to see you.
Hi, Julia. Thank you for that presentation. It's really interesting. And as you know, I'm kind of interested in developing the conversation with you and other folks in your emergency management space about in what ways we could move toward training our students with more awareness of and expertise of the work that you do. I wanted to let you know that I was party to a really interesting conversation up in Helena last week with Commissioner Hunthausen from Lewis and Clark County, who was talking about a need that he recognized, which was to normalize public health professionals as members of the community who respond regularly to emergencies, whereas people are accustomed to seeing fire and police and EMS professionals. But I think what he was talking about was like in comparison during the pandemic, there was more of a reaction to the public health workforce of like, now who are you again? And I was wondering if you had any thoughts to share on that, what seemed to me very important point and area of need.
Yeah, I'm so glad you brought that up. So like I said, I am a part of the all hazards incident management team. And I'm the only person on that team who represents public health. And so even within our own responders, public health can sometimes be like, wait, who are you? Who do you work for? Why are you here? I think it's helpful in some ways helpful post-COVID. Sometimes there's still some sour tastes in people's mouths, like you didn't do COVID right. You should have done it differently, which is fine. we can deal with that. But I think that's an excellent point, not just from the public's perspective, but on our own responder community. We need to talk and we need to be friends and we need to not exchange business cards on the day of the incident. We need to already have those relationships established going in. So I know I can call the fire chief and be like, hey, it's me from the health department. You know me because we went on all these incidents together. We trained together. I need your help. And vice versa. They can call us too. I think it's super important. And so I'm glad that this is being seen as a need, because I think it will continue to be a need, again, as we look at climate change and all the public health effects that will come from that. We will continue to be called for emergencies.
Thank you.
Of course. I don't see anything else in the chat, but any other questions?
Yeah, any questions for Julia? Feel free to unmute.
Thanks, Julia. I had
Go ahead.
one more question. Oh, sorry, B-Rad. Just a quick question about if, I logged into Smart 911 when you showed that slide. Thank you.
Yeah.
I had a profile back in 2016 and didn't receive any information like when we did have the windstorm, the derecho, the Pacheco, I can't remember what the fancy name is.
You got it, Rachel.
Yeah, so I'm wondering what else I might have, what else could have been done? If you're supposed to log into that every 6 months to receive communication, okay, my bad, didn't know that.
It might
But
be
also
once a
too, like,
year. I don't
It just
remember.
said 6 months.
Oh,
So,
6 months. I get alerts.
yeah.
So yeah, if anybody out there has signed up in the past, go ahead and pop on the website and see if you need to renew. I don't know how it ever worked in the past. I can't speak to that, but I have gotten emails and texts from Smart 911 saying, hey, you need to update your profile. And it just takes you logging in for it to be updated. So and to your point about the derecho, not a lot of people actually received emergency alerts for that event because it's very targeted. It's like neighborhood by neighborhood, address by address. So there was like an emergency water shutoff that happened during the derecho. Like, hey, don't use too much water because that was a problem. And that only went out to specific neighborhoods where that was an issue. So I have heard people in the aftermath of that being like, why didn't I get an alert? Like, because you didn't need one. Yeah, so anyway. Did you have another question? Sorry.
Yeah, just what else could we as the public could have done to receive information? Like, we used to have the emergency alert system that was tested, gosh, back in the 80s. I remember getting and I just didn't receive communication. So what could I do differently to make sure that if I don't have Facebook?
That's a great question. I don't use Facebook either. I feel like I will need to again for my job, but I will go back kicking and screaming. I mean, social media is great. Smart 911 is great. Also know that if it's like a national alert, you're going to be alerted no matter what. I can't remember what the acronym is right now, but like the Amber alerts and all of those, like they come directly to your phone even if you haven't signed up. So know if someone's trying to get a hold of you, you will be gotten a hold of. I wouldn't worry about it too much. And I could probably do a whole nother, and maybe I will do a whole nother seminar on just our emergency alerts because they are a little complicated. But Smart 911 is your best option. And when you sign up, it does have like a different check boxes that you can check saying, yes, I want alerts, sent to me, not just that dispatch has more info about me. I do want to receive messages. So just make sure you check all those boxes.
Got it. Thank you so much, Julie. I appreciate that.
Yeah, not a problem.
Great. And B-Rad for our last question of the afternoon.
Oh, thanks, Julia. I just wanted to comment. I've taken the ICS courses, and the way you explained the things, the people that do the things, the people that get the things, that's just really such an effective way to explain that. I wish they included that because I went through a lot of courses, and that really clarified hours and hours I've spent trying to understand that. So thanks for that.
Of
And
course.
also, I know a lot's come to public health since COVID, and I think you talked about some of those things. But I'm curious, like with the ICS, like with their, like as far as like the courses that they're offering, do
Yeah.
you know if they've taken any lessons learned from COVID and updated those courses? Or are those courses pretty similar to what I would have taken like in 2016?
That's a really good question. I don't know like what makes FEMA change their courses, but I do know that a lot of those like basic online courses are really general. They're like the broadest brush you can use to try to learn about this system. So it's not very hazard specific. So I wouldn't think so for like 100, 200, 700, 800, but I haven't taken them again either since 2020. So like since before or during the pandemic. So I'm not really sure. And to your point about just my explanation, it's so important if you're really invested in this stuff to try to take like 300 and 400 because those are in person and that's when you can really like ask good questions of your instructors or like the way I explain ICS, that's the way it was explained to me by Ken Parks, who's the incident commander for our team. So the more you can practice or learn this stuff in person, as much as I try to promote the free online stuff, it's pretty dry. It's pretty like basic and like death by PowerPoint. That's just kind of the way it has to be. But yeah, the more you can do stuff in person, the better.
Great, thank you.
Of course. Thank you, B-Rad.
Yeah, and thank you, Julia. We've hit our time, but thank you so much for this presentation. And I know that, with our academic health department relationship, we will look forward to seeing you again in the future.
Of
So with
course,
that,
yes.
thanks everyone for being here, and we'll look forward to seeing you all next week.
Yeah, thank you all for being here. Appreciate it.